Good afternoon and welcome to the daily briefing where we're bringing you the latest on the numbers in St. Clair County. I'm joined with Chairman Mark Kern and Sam Bierman from the Health Department. Sam, good numbers.
We do have very good numbers today. We're going to keep our fingers crossed that we stay on this trend. So as of today, 77,443 St. Clair County residents have been tested, which is an increase of 706 from yesterday. We are at 6,852 positive test results, which is an increase of 46 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. And our daily county positivity rate today is 6.5%. We are at 70,591 negative test results and are still currently at 182 deaths, so no new additions to that category today. And for those who have completed their IDPH required 10-day isolation period, we are at 6,125. For state totals, 4,920,938 have been tested, with 268,207 positive test results, which is an increase of 2,056 from yesterday. And for deaths, the state is reporting 8,392, which is an increase of 25 from yesterday. For our hospitalization numbers, for St. Clair County hospitals, currently 42 patients are admitted due to COVID-related reasons, and 2 of those individuals are on ventilators. And for regional hospitalization numbers, currently 82 patients are admitted due to COVID-related reasons, and 7 of those are on ventilators. For congregate living facilities that are in outbreak status, and that does include staff and residents, either 2 or more that are COVID positive or who have COVID-like symptoms. As we've done in days past, we're only going to announce the facilities that have had any changes. The first is Caritas Family Solutions in Belleville, which has 35 cases and no deaths, which is an increase of 1 case. 4 Fountains in Belleville, which has 115 cases and 28 deaths, which is an increase of 2 cases. Integrity Healthcare of Belleville, which has 9 cases and no deaths, which is an increase of 1 case. Knollwood Retirement Center in Caseyville has 9 cases and 1 death, which is an increase of 1 case. St. Paul's Home in Belleville has 59 cases and 15 deaths. That is also an increase of 1 case. And finally, Swansea Rehab and Care Center has 43 cases and 8 deaths, which is an increase of 1 case as well. And before I turn it over to the chairman, I'm going to, as we did last week, we had the graphs that showed where people were previous to becoming positive that we had found out through our contact tracing efforts at the health department. Our top 5 for this week are healthcare, employment, travel, restaurants and bars, and education. And as we see, those numbers are higher than last week, but that means that we have also tested more, we are contact tracing more individuals, and that is showing us that not only is the contact tracing working, but the mitigation efforts that we have put into place are working as well. So we're very happy about that. We've had some really good news today, good county positivity rate. So overall, a really good day and hoping to stay on that track.
And those places that people contracted COVID, you put those in the order of the most people were in healthcare, and then it went.
Correct. Those were the
beyond.
top 5. Yes, healthcare was the highest, followed by employment, travel, restaurant and bars, and then the lowest of the top 5 was education.
Okay.
Yes.
Thank you, Sam. And
Absolutely.
also, I think we found out today that, Team St. Clair has often talked about how the state numbers differ from St. Clair County
Yes.
numbers, and we've been working for a number of weeks now with Illinois Department of Public Health. Representative Hoffman got involved heavily with this issue, and I think they seem to be working through this.
Yes.
So the numbers are getting closer. I know that BJC now is reporting so that the numbers get attributed to St. Clair County.
Correct. And I want to make sure that everyone understands that we have always been getting BJC numbers, and they've always been accounted for in the numbers that we provide for St. Clair County. It's just that we weren't getting credit from them for the state numbers. They were being included in state numbers, but when they were sparsed down into individual counties, that's where we weren't getting credit. But they've always been a part of our numbers, so we we take great pride in the fact that we are able to provide the most accurate and correct numbers.
And that's why, we've always said that here are the numbers that we know are correct. We got names, addresses, we know the number, the amounts. You spend multiple hours a day with multiple people in the health department crunching all these numbers, and then Brian and Randy and Herb work and everything gets put together. So we know as of 3:30 every day that we have the most accurate number available. That's why we're sure they're there, and we appreciate Representative Hoffman helping us to get other people's numbers to be as accurate as ours.
He was certainly instrumental in bringing everybody to the, I guess, proverbial table, if you will, so we could all get on the same page. So yes, it's a big step in the right
That's
direction.
one of those mini conference calls.
Yes, yes.
All right. Thank you, Sam. And one more thing. The state numbers are really going up.
They are.
So we were down in the 800 level statewide, and now we're above 2,000 again. That's a concern and a trend that we are not mirroring here right now, but one that we need to keep our eye on, because for some reason there's been significant growth in the state.
And, as we've said from the most recent holiday, we thought that, we were going to see, and if we were going to see an uptick, it would have been around this time and for the next couple days up to the weekend. And it seems that's what we're seeing in state numbers, is that perhaps some people went out and had a little too much fun, weren't wearing their masks, weren't, perhaps socially distancing. So we had somewhat predicted that trend. We were hoping it wouldn't be as high, but that's what we're seeing right now.
Anecdotally, it could be the colleges are back in, and those numbers now are starting to filter in and be reported. So
Yes.
we'll just have to keep our eye on that.
Yes.
Both eyes.
Both eyes, Herb. Okay, and we know that we've got a zip code report to do. So as always, recently, we're going to read just the zip codes where there are changes. So we'll start today in 62206. We go down one to 425. In 62208, we go up 2 to 415. 62221 goes up 4 to 642. 62223 goes up 3 to 392 COVID positives. 62226 goes up 5 to 707. 62232 goes up 2 to 190. 62240 goes up 1 to 32. 62254 goes up 4 to 249. 62258 goes up 6 to 188. 62260 goes up 1 to 134. 62269 goes up 7 to 536. And 62285 goes up 9 to 92. Today, as you heard, our daily county positivity level, as we calculate and run the numbers here, is 6.5%. And what that does is that takes our 7-day rolling average to 6.4%. So we now are below that magic 6.5% level, at least a goal that was originally set for the region, to be able to get back to where we were before the recent rollback. Of course, these are just St. Clair County numbers. They're not regional. So we know that here we've met that metric. Hopefully our neighbors will be able to do the same. The regional positivity rate, though, today is also down. It's down to 8.4%, and we were part of that, bringing it down. Bond County was at 7.7% today. Clinton was at 11.1%. Madison County still higher with 14.4%. Monroe County, 20.8%. Randolph County was 3.4%. They're the lowest in the region. St. Clair today, 6.9%, and these are all state numbers according to the state, 6.9%. And Washington County comes in at 10%. So, Herb, numbers looking better for us. I think it's encouraging. It certainly is. Kudos go out to Team St. Clair for their efforts.
188 days and counting. So it's just, it's good to come in here and see the numbers, as Sam said. It shows the contact tracing is beneficial, as well as the mitigation. A lot of news last night on, if you follow the news about the mask, the CDC came out and said the mask is still important. Of course, there were still some of the naysayers saying that they're not. So don't care, I'm going to go along with the medical experts.
Yeah, the head of the CDC actually said it is the most important thing, and that he held the mask up and said, you know, this may be more important than even a vaccination. And
Well, yeah.
later on, then everyone said, or at least some were saying, that it's also going to be very beneficial during the flu season. So it may doubly protect us, get us through. It'd be nice to get through a flu season where we don't get sick with the flu.
Well, and the physicians that we've had on here has said that one of their main concerns is the flu season coming on, the double whammy as far as really the difference between the flu and this COVID. It's going to make their job a little bit tougher, having to diagnose the difference of them and then the treatment of it. And then, of course, the hospitalization. We saw the hospitals go up a little bit today, and as we said, you know, when you look at it here, 42 people, but it's called preparation, as we say all the time. You got to be prepared for the if come. And I keep referring back to a storm that would come through, and kind of like what Marissa had go on down there. If that would have turned into be a bigger disaster, people getting injured, hospitals get overloaded, that's what you have to look at. You just don't look at just for COVID patients. You look at for what other type of heart patients, diabetics, things of that sort that may require hospitalization. So it's a big preparation that you have to make. And you Team St. Clair members out there, you've done good. Let's just keep going, as the chairman says all the time. Got to keep the foot on the gas for the time being. Sam mentioned it a few moments ago. We're still, hopefully by the weekend, we're going to see if there was a Labor Day spike there. We've seen the numbers, as the chairman said, 2,056 cases across the state, which is considerably higher than what we've been seeing the last week or so. So I'm sure the state's watching that. The great news is the BJC. Again, thanks to Representative Hoffman for all his hard work of getting, we've been getting those numbers, but we just now got a better clarification on them. So we are going to be back here momentarily with Daisy to translate this into our Spanish communities. And then please, tonight, just keep your fingers crossed that these numbers keep going down, and we'll get back to that new norm or whatever that's going to be. And we'll be back in a few moments, and then we'll see you tomorrow afternoon.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock